The symptom in French psychoanalysis. French psychoanalysis, particularly in the tradition of Jacques Lacan and his followers J. A. Miller, S. Lejeune, C. Melman, has developed a specific approach to the understanding of symptoms. Unlike classical psychiatry or even early Freudian psychoanalysis, the symptom here is not regarded merely as a pathological phenomenon to be eliminated, but rather as a structured expression of subjectivity, a mode of articulating the conflicts between the symbolic, the imaginary, and the real dimensions of the psyche. The symptom functions simultaneously as a marker of the unconscious, as a metaphorical construction, and as a support through which the subject maintains psychic consistency. 1. The symptom as a message in language. In Lacan's classical formulation, the symptom is a construction of speech that functions as a message from the unconscious. It arises as the result of repression, through which a desire forbidden by the symbolic law returns in encrypted form. Theoretical emphasis: the symptom has the structure of metaphor and metonymy, and thus must be read in the same way as a text. Clinical example: in hysteria, bodily symptoms, paralysis, spasm can be interpreted as the symbolic articulation of unspoken desire. Lacan: the symptom speaks. It expresses the grammar of the subject, shaping their position in language. 2. The symptom in the dimension of the real. Lacan defines the real as that which always escapes symbolization and representation. Symptoms appear precisely where the symbolic structure proves insufficient for integrating the subject's experience. Manifestation: in psychosis, the symptom often appears as an intrusion of the real, hallucinations, delusions, ruptures in speech. Essence: the symptom bears witness to the impossibility of total representation, a remainder that recalls the whole in the symbolic order. 3. The symptom as symptom. In the later phase of his theory, Lacan rethinks the notion of the symptom, introducing the term symptom. This concept emphasizes not only the pathological, but also the constructive dimension of the symptom, meaning the symptom is a kind of knot that enables the subject to sustain subjective consistency. Example: in the case of James Joyce, Lacan showed that his literary practice functioned as a symptom, protecting him from the collapse of a psychotic structure. Conclusion: the symptom may serve as a way of organizing life, even if it simultaneously generates suffering. 4. The symptom as the result of the interaction of three orders. Lacan distinguishes three registers: the symbolic, the imaginary, and the real. The symptom arises precisely at their intersection. Imaginary: the symptom may appear as an image or fantasy that masks a traumatic kernel. Symbolic: it is always structured like a language, an effect of laws and prohibitions. Real: the symptom is that remainder which cannot be inscribed either in the imaginary or in the symbolic. 5. The symptom and desire. In Lacanian discourse, the subject's desire is always mediated by the desire of the other. Symptoms emerge as the effect of a conflict between one's own desire and the expectations, norms, and prohibitions imposed by the other. Example: anxiety symptoms may arise from the subject's impossibility of aligning their desire with the symbolic demands of their environment. Formula: the symptom is a letter that always arrives at its destination, an unconscious message addressed to the other. 6. The symptom as a rupture in the symbolic order. This is of particular significance for psychotic structures. Lacan showed that psychosis is the result of the foreclosure of the name of the father from the symbolic order, i.e., the absence of the fundamental instance that introduces law and limit. Manifestation: intrusions of the real in the form of hallucinations, delusions, or feelings of external control. Example: in paranoia, the symbolic structure collapses and the real begins to speak directly. 7. The symptom as repetition. Lacan integrates Freud's concept of the compulsion to repeat. Symptoms are not merely accidental, they often function as cyclical returns of trauma. Essence: the repetitiveness of the symptom is an attempt to work through that which remains unresolved. Example: a subject who continually enters destructive relationships repeats an unconscious scenario rooted in childhood experience. 8. The symptom as part of subjective structure. French psychoanalysis conceives of the subject through three fundamental clinical structures: neurosis, psychosis, and perversion. Neurosis, symptoms, phobias, hysteria, obsessions are linked to the conflict between desire and law. Psychosis, symptoms, delusions, hallucinations result from the collapse of symbolic support. Perversion. Symptoms manifest as specific scenarios of jouissance, sadism, masochism, functioning as ways of maintaining subjective position. Number 9. The symptom in therapy. In the French tradition, the task of analytic practice is not so much the elimination of the symptom, but rather its rewriting, integration, and subjective appropriation. Key concept: jouissance, a particular form of enjoyment linked to the symptom. It cannot be fully eliminated, but can be resignified. Clinical examples. Little Hans. The horse phobia is interpreted as a symbolic defense against castration anxiety. Hysteria. Symptomatology functions as an appeal to the other, a demand for recognition of subjectivity. Conclusion. In French psychoanalysis, the symptom is not considered an accidental deviation from the norm, but a fundamental mode of the subject's existence in language and in the structure of desire. It is simultaneously the expression of conflict, a mechanism of compensation, and a way of organizing psychic reality. The symptom always indicates the limit of symbolization and opens access to the unconscious. Thus, the analyst's task is not to cure the symptom in the medical sense, but to assist the subject in hearing, reading, and integrating their symptom as an inseparable element of their subjective structure.